So I have two consecutive presentations. Both are focused on the focal one system. It's a MRI ultrasound fused image guided HIFU. In the first presentation, we look at the overall population of patients who underwent HIFU with this device and look on the impact of PSA and complications on the genitourinary functions from our initial experience with the focal one. So the conventional HIFU was done with truss guidance, and the focal one offers the guidance of MRI ultrasound fusion, which enable us to perform focused targeted ablation. Between June 2014 to October 2015, we performed HIFU in 85 patients with localized prostate cancer. This includes focal and whole gland ablation, and also primary and salvage setting. The preoperative cancer localization was done routinely with a multiparametric MRI and truss biopsy, which is usually a bisextant biopsy. However, some of these patients received MRI targeted biopsy. And the HIFU was performed using the focal one system with general anesthesia. And our routine follow-up includes 1, 3, 6, and 12 months. And we measure PSA during this time and validated questionnaires during the same period of time for the genitourinary function. And at 12 months, we perform a control biopsy and an MPMRI, which is mandatory for all the patients. And the complications were reported using the Clavian system. The mean PSA, the median age was 70 years in our cohort, and the median PSA was 7.9. The total cancer length was 7.5, maximum of 15 millimeters, and the prostate volume was 40 cc and maximum of 70 cc, which is not a limiting factor with this new system. It's just a relatively a larger focal point and do not require pre-treatment TURP routinely. However, 22 patients underwent TURP primarily for the obstructive symptoms, not as a pre-treatment criteria. And 71 of these patients had a suspected lesion in the MRI. And the split up is the focal treatment was 64, whole gland treatment was 21, and salvage HIFU was 10. And most of the patients were Gleason 3, and 3+3 and 3+4, and a very small proportion higher than that. This is a representative image of the focal one system, where we can contour the image using with the MRI information, and the efficacy of seen in the post treatment MRI. Most of the complications we had were related to Clavian 2, limited to dysuria, hematuria, and infections, and the mean hospital stay was 1.8 days, and catheter was removed usually on the second day. The mean PSA reduction was around 55% in the whole cohort of patients, and we had a median follow-up of 3 months, and during the time of this abstract preparation, we had only 4 patients who had a controlled biopsy, 8 patients who had a controlled biopsy, out of which 4 had some residual disease in the treated area. All the patients were continent at 3 months, and they were 83% of the previously potent patients were potent after the treatment. So the MRI ultrasound fusion guided HIFU appears to be a safe procedure, and with few low-grade complications. The functional outcomes were good, with no urinary incontinence, and the sexual function was maintained in 83% of the previously potent patients.
Thank you. If there are no questions, we'll just have you go on to your next presentation. Okay.